good morning, and happy Friday to you. My name is Dr. Donna Patterson, and it's been a long day. I've been at work all night for 13 hours, and I'm getting ready to go to bed. But before I do, I wanted to take a moment to talk to you about the latest weight loss medication that's on the market. This is something that I've been wanting to discuss, but I've not had the time to sit down really and talk about it. So I just thought, why not get it done today before I go to sleep? So what is this drug that we're hearing about? You may have heard about this on social media or otherwise. It is called semaglutide. Semaglutide, also known as Ozempic, or also in the pill form is known as Rybelsus. Semaglutide is also now approved by the FDA for weight management, is known as Wegovy. So what are these medications and what's the difference in the name? Well, if you've heard of semaglutide, whether you're taking semaglutide or you're taking Ozempic, those are the same medication basically. One is a brand name and the other is a generic name. The pill form of that same drug was approved by the FDA actually for people especially who don't like injections, right? So Rybelsus is a pill form that you take, and it has shown to be just as effective as the injection form. So Wegovy was originally approved in 2017 by the FDA to treat people with type 2 diabetes. And what that means is that people who are diabetic and were not getting good benefit from their diabetic medication were given this as an adjunct or a second or third option, whether they were on insulin or whether they were on metformin, and they were not seeing reduction in their hemoglobin A1C, which is the lab value that tells a person or tells a doctor how well a person's blood glucose level is controlled over a 90-day period. So if they were not experiencing good result on these medications, semaglutide was approved as an adjunct medication to help with that. However, while people were taking this medication, or while patients and clients were taking this medication, they were experiencing significant weight loss. And as a result of that, additional testing was done, and doctors were beginning to prescribe this medication for weight management, not just for those people who were diabetic, but anyone who were experiencing excessive weight and wanted to lose some weight. However, keep in mind that semaglutide is approved, or it is for people who wants to lose an excessive amount of weight if your BMI is greater than 30, or if your BMI is greater than 27 and you actually have at least one risk factor or comorbidity, for example, hypertension as a result of being overweight, or hyperlipidemia, or that is known as high cholesterol, and so, or cardiovascular disease, coronary artery disease. And so this medication was being used, and as a result of that, there has been a shortage on the market because now people who were diabetic were not able to obtain this medication because so many people were using it for weight loss. And that is great. It's great that people were getting results from it, and it's great that it has proven in over 4 studies that this is superior to other medications that have been in the same drug class. Okay, so what is semaglutide? What's the drug class? It is called GLP-1, which is also another term for glucagon-like peptide. This peptide basically is used to stimulate the insulin release from your pancreas or the pancreatic cells that will promote blood glucose in your blood to move from the blood to the cell. So it can be utilized for energy. And so semaglutide has been shown to be very effective in doing this. It also causes us to have a sense of fullness when taking this medication. It is taken once weekly as an injection form, usually given in the stomach. I won't say muscle because it's a subcutaneous injection, usually given as a shot in the stomach. And it has been shown to be very effective, in which people on this medication were experiencing anywhere from 5% to 15% weight loss. And that, based on how much you weigh, 5% could be a lot. 15% in a 300-pound person could be 60 pounds of weight. And so this is where the big crave came from. Some of the side effects that came with taking this medication were mostly gastrointestinal effects. And these effects were basically such as nausea, vomiting, diarrhea, or just upset stomach. Some people can tolerate this because it's mild to moderate symptoms, but others have found that they're not able to tolerate it and have stopped taking the medication. However, in order to be able to tolerate this more, some people have taken what is called anti-nausea medication just to ensure that they can tolerate this medication, because of course the goal is to lose weight, and that is very important, especially when it comes on to our health. And so here we talk about semaglutide, which is also known as Ozempic, also known as Rybelsus in the pill form. So Rybelsus was approved in 2009 by the FDA as an oral tablet. And this medication can be taken orally, as I mentioned before. And most people taking this medication do experience the stomach upset or the GI upset. However, it has been shown to absorb very quickly. And these medications, semaglutide, help us to feel fuller longer, which means that it takes longer for our stomach to empty the food out of it. So we have this sense of feeling full. It suppresses our appetite. We're not eating as often or as much, and as a result, we experience weight loss. But of course, keep in mind that with this medication, it is also recommended that we promote and that we do exercise and that we change our lifestyle. Lifestyle change is recommended. So whether that is incorporating exercise and dietary changes to ensure that you have long-lasting effect of this medication and that you get the best possible results, not just to drop 2 pant size down for the summer and then your weight goes back up, but it has been proven that you can actually sustain your results on this medication by incorporating lifestyle changes. So that is definitely recommended. Of course, I mentioned the advantages of taking the pill form of this drug is because for those people who may be afraid of needles or afraid of giving themselves injection, they can take a pill. So it makes it easy for a wide range of people, those that have no problem giving themselves an injection or having an injection given to them, as well as those that are deadly afraid of needles. Now they can just take the pill. So these medications have proven to be very effective. And as a result of that, and as a result of the excellent studies that have been performed, we had the Pioneer 4 study that was done, the Pioneer 2 study that was done, and it showed with over 52-week period of the medication being given, because the dose is usually titrated up. You start at the lower dose and it's titrated up until you reach the maximum dose if it is titrated based on your results. So you would take it 1 shot per week. However, the results of the studies have shown that this drug has been so effective that the FDA has gone ahead and approved it for weight loss. And the name of the one approved for weight loss specifically is the same semaglutide drug. It's not different. The only difference is that the dosage is higher. So this drug is now called Wegovy. And Wegovy is semaglutide, but Wegovy is approved for weight loss. Whereas semaglutide was originally approved for diabetes, but it was shown to be effective, and so it's being used for weight loss. And the generic name for that is also Ozempic or Rybelsus, which is the pill form. And so Wegovy is indicated for weight loss as an adjunct to lifestyle modification. It is used for weight loss in people who have chronic weight problem, people who have body mass index or BMI greater than 30, or people whose BMI is greater than 27. However, they struggle with at least one comorbidity or one disease associated with weight, hypertension, hyperlipidemia, and type 2 diabetes, of course. And so many insurance companies will approve this medication if you're type 2 diabetic. However, if you're not diabetic, your insurance may not want to pay for this medication, and so it can be quite costly paying out of pocket for it. So it is recommended, of course, that before you take any new medication, even though so many people are having great effects with this, before you take any medication, it is best that you talk to your primary care physician first. Before anyone can even start this medication, you have to have physical examination done by a healthcare provider, and you have to have your lab work reviewed to make sure that there are no contraindications to you taking this medication. And so at Rejuvenaire Health, we provide Wegovy as well as semaglutide as one of our weight loss or medical weight loss drug option. There are numerous options out there. You may be familiar with some of the pill, like the pill called phentermine, and there are so many others that are out there. There are over 20 medications used for medical weight loss, which means that you cannot get these medications over the counter. You have to have a prescription, or it has to be prescribed by a healthcare provider. And so at Rejuvenaire Health, I am a healthcare provider, and so we provide this medication to patients who qualify to help us lose weight, to maintain our weight loss, and of course, to have a healthier lifestyle, because the goal is for us to live a healthier and happier lifestyle. So if you need more information, don't hesitate to contact us at Rejuvenaire Health on IG. You can also contact us at 678-643-2253. You can send us a DM, you can send us a text message, you can call us, or you can check out our website at rejuvenairehealth.com. It is my pleasure talking with you today. I look forward to more conversations as we dig deeper into this weight loss crave. And our next topic will be, we will be talking about the next bad boy in the market called Mounjaro. Mounjaro is approved for weight loss, and it is shown to be super effective. And then we will compare the difference between semaglutide and Mounjaro. Okay, so you guys have a phenomenal day. It is time for me to go to bed. And until next time, my name is Dr. Donna Patterson. You all have a phenomenal time. Take good care of yourselves. Bye for now.